My name is Brandon Mako, and today we're going to use a Suresult D3Ultra Handheld Ultrasound to evaluate the Achilles tendon. Now, you can have a tendinopathy, a tear, a tendinosis or tendinitis. You can have Haglund's syndrome. You have a bit of a bone spur and enthesitis. You could have retrocalcaneal bursitis, both with a Haglund syndrome. You can have retroachilles bursitis as well. So let's quickly check for all of these. Keep in mind, if you are evaluating the Achilles tendon, you may want to evaluate the tibialis posterior tendon as well, or the posterior tibial tendon. Two names for the same thing. Okay, so to get started, we have our probe here. Let's get some more gel on this. For patient positioning, if this is all I'm evaluating, then I like to have the patient prone with the foot up on a bolster. And if you don't have a bolster, it's not a big deal. Have the feet dangling off the edge of the table, and that's fine. In general, though, if I'm evaluating a lot of structures in the ankle and foot, or basically the lower body, I prefer to have the patient sitting. Why do I have the patient sitting? Well, then the foot's dangling in front of me. Sometimes I have to kneel down to get access to the foot, but I can go all the way around the foot and manipulate the foot and do dynamic imaging and everything I want. So that's actually my preferred patient positioning if I'm going to scan a lot of structures. If I'm scanning just the Achilles tendon, then this is my preferred position. In terms of marker positioning, I'm going to place the marker either superior or medial for this right Achilles tendon, which we're doing. Now, when in doubt, you can always use split screen and compare the right to the left so that you have a comparison, for example, symptomatic versus asymptomatic. Okay, so let's get started. I'll unfreeze it here. Right now I have compound imaging off, and I have a transverse view. Let's actually start with a long axis view, and I can move the foot to try to straighten out that tendon. Sometimes you need a lot of gel as sort of a standoff to fill out sort of the curve of that tendon so that you don't have any gaps where air can mess up your image. So we can see some fibers of the tendon. Let's start right from the calcaneus. You don't want to apply too much pressure or else you'll miss a retroachilles bursitis. So I sort of take off pressure and see if there's a fluid sac that appears behind the Achilles tendon. There isn't. If I want to look more carefully at that insertion, if it looks dark from anisotropy, so I can heel toe the transducer and make sure those fibers fill in. And they do. There's nothing wrong with that attachment. So the retrocalcaneal bursa would be, if I freeze this, would be in this space here. So we just keep an eye out on that space. And we can come through and we can look at the tendon. So for tendinitis or tendinosis, you typically look sort of mid-tendon and you would see it. So if I freeze this, we want to look to see if this tendon is thickened and hypoechoic, so thickened and dark. If you're not sure what's normal or not, just compare with the other side. And you should be practicing, you should see normals. It's typically twice the size if there's a pathology. Like, it's obvious. If we're looking for tears, a full rupture, it's going to be missing. So actually, let's use split screen just as an example. So I'll unfreeze this, turn on split screen, then switch to the other side, steal a little bit of gel from the sides here. And see, it looks about the same. It's the same color. Remember, it would be darker and thickened if there was a pathology. Now, I prefer to have compound imaging turned off, particularly when I'm moving around, unless I need it, because it does make the images look better, but at the cost of frame rate. So let's just show that to you. So there we have our normal image, and if I turn compounding on, right, that image looks better, right? You can see the edges of the tendon more clearly. So if I'm taking a nice picture, I'll turn compound imaging on to take a nicer looking picture. You should scan through every structure in both axes. So we can scan through here. And there's nothing that jumps out at me wrong with this Achilles tendon. And that's it. I hope you found this useful. Cheers.